If you're having shoulder pain and wanted to do some physical therapy to improve that pain, I made this video specifically for you guys, so make sure you stay tuned. Hey, how's it going? This is Saman here from All Things PT, and in this video I'm going to go over some exercises that you could do to eliminate your shoulder pain. Now before we begin, if you wanted to make sure if you have a rotator cuff tear or a shoulder impingement, please make sure you watch the video above. In that video I have gone over a couple of special tests that you could do at home to find out if you have a rotator cuff tear or shoulder impingement. And after you do those tests, if you find out you have a rotator cuff tear and not just a shoulder pain, please look at this video right here. And in that video I have went over some exercises that you can start to do if you have a rotator cuff tear. Now if you have a rotator cuff tear, you can do those exercises like I just said, but then as you progress, you can come and do these exercises, okay? Because sometimes what happens, if it's a small rotator cuff tear, then it's going to heal by itself, but it's going to be still painful. So you have to load it appropriately so that it can heal better. And this is when you come back and do these exercises. If you just have shoulder impingement, then you can just start right here, okay? So without wasting your time, let's start our first exercise. Now our first exercise is going to be an L stretch, and you will need a counter. Something about at least your waist height or maybe a little above. Anything below, it's going to be a little too less. When it comes to pain, let's pause this video real quick. When it comes to pain, if you feel like this is your pain and this is your movement, you should just be touching the pain so that your pain tolerance eventually increases. You don't want to smack the pain, because if you do, it's going to come right back at you and hit you in your face, and then what's going to happen, you're going to be too sore the next day and you feel like these are not working, and it will just lead to frustration, right? So just touch the pain, maybe push it just a little bit, but don't smack it, because it's going to smack you back. What you're going to do, you're going to put your arms like this as I am showing, and you are just going to walk back. You're going to lead with the chest, and maybe for the first time I only go a little bit, that's fine, but with practice, right, I will go lower and lower every time. And you are just going to make sure you go deep, get a good stretch on your upper back, okay, and go back up. What you're going to do, I forgot to mention, you're going to gently push down on the counter as you go back, okay? Just walk back, walk back, walk back. And as things start improving, you will be able to go all the way down. It may take a couple of days, it may take a week or two, but stick to it. Touch the pain, don't push through it. And you are going to do that about 10 times or so. By the way, while you are in this position, hold for about 5 seconds or so. Okay? I'm going to do 10 times. And this exercise, you can do it even up to 10 times a day, because this will really help to open up that shoulder joint, get that blood flowing, give that nice stretch to your upper back. Like I mentioned in the previous video, a lot of shoulder problems is not necessarily because of something's going on with your shoulder. It's because your shoulder blade or your scapula is not rotating as you go up. And so a lot of time it's because you have weak muscles on your shoulder blades. So we're going to correct that. What you're going to do, same on the same kitchen counter, you're going to lie down at about and bend down to about 90 degrees, okay? What you're going to do, you're going to pull that arm this way. You have to make sure your thumbs are not pointing this way or up. It's going to be a little provocative, so maybe more this direction, okay? So here. And what you're going to do, you're going to initiate that movement with your shoulder blade first. So you don't want to just go this way. You want to squeeze your shoulder blade first and then pull up. And then relax and down. Squeeze your shoulder blade up and pull up. And relax, relax. Squeeze your shoulder blade first and then pull. Relax. Squeeze your shoulder blade first, then pull. Squeeze your shoulder blade up, pull. You're going to do that about 10 times, maybe twice a day, okay? For the next exercise, now you are going to need either a TheraBand like this or a bungee cord. That works well as well. You are going to make sure you squeeze your shoulder blade first. You are going to start holding the bungee cord or the TheraBand very close, okay? Squeeze your shoulder blade, and all you're going to do is you're going to go up to 90 degrees, okay? Just up to here. So hold for 5 seconds, squeeze your shoulder blade, and relax. Hold, squeeze your shoulder blade, and relax. As you get better, you can go wider, and then you can pull all the way up. You should be feeling this muscle right here, okay? That working. Again, you're going to start from here, hold 5 seconds, and as you get better, you're going to grab a little farther, and you're going to go all the way out like this. You should be feeling this muscle working right here. And what we don't want to do when you do this, a lot of time people will start doing something like this. You don't want to do that. You want to make sure you keep your elbow nice and close to your body and do that, okay? You're going to do that 10 times as well. Another exercise we're going to do is going to be the chest stretch. You are going to find yourself like a corner of a wall or something. And what you're going to do, you're going to put your shoulder at about 90 degrees or so, just this way. And you are going to step forward with your opposite leg and feel a good stretch in your chest, okay? This is a very simple one. Just going to zoom this one out. And again, you're going to be here like that. And then you are going to take a step forward and feel the stretch right here in the chest. Because a lot of times we're in the front of the computer doing this kind of thing, right? So what's going to happen, we're going to have really tight chest. And when you have tight chest, as you go up, you'll have some impingement, okay? So you're going to be here. And then you are just going to take a big step, and then you are going to feel this stretch, okay? For 30 seconds, maybe once, maybe twice. Just make sure you take a step and feel the stretch, okay? 30 seconds, very simple. The final exercise, we'll need to lie down on our back. For the final exercise, you'll need to be in your bed or a couch or something, or even on the floor if you don't have a hard time getting up from the floor. You're going to lie down on your back, okay? And so what you are going to do, you're going to put your affected arm straight up at about 90 degrees. Keep your elbows straight, and you're going to push up like this. This is going to work our serratus anterior. That is really crucial for moving our shoulder blade up, and so that you don't pinch that muscle at that supraspinatus, okay? Push up, hold for a few seconds, relax, push up, hold for a few seconds, relax. What you don't want to do is this. I see a lot of people do something like this. And although, yeah, you feel like you'll never do something like this, you'll never know. We did a counter stretch, we did a what you call technically a prone horizontal abduction, we did a bilateral external rotation, we did a chest stretch, and we did a serratus punch. That's a 4 or 5 exercise, right? Again, the focus needs to be primarily on the shoulder blade, not just the shoulder, okay? Hopefully this video helped. If it did, please make sure you hit the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.